everyone, welcome back. I have been waiting for this. I have been very much wanting to talk to Joyce Griggs about health advocacy because, wow, I think we all need a lot of help. And with the new beautiful bill, I'm going to guess that this is going to get a lot harder. So, if you are familiar with me and my story, you certainly know I've had my own issues with advocating for myself with doctors. So I'm going to jump right in. Hi, Joyce. I'm really excited to get to talk to you today. Can you tell me? I believe when I read your intake form, you told me that you yourself are not disabled. What led you to this?
No, I'm not. What led me to this? So I created United States of Healthcare because of a family crisis. My former partner had knee replacement surgery, which is pretty routine, but he also had severe anxiety. And he had been on psychiatric medications for a number of years, and his psychiatrist just kept putting on higher and higher and higher doses. And it finally got to the point where he was impaired, like seriously impaired by the amount of medication that he was taking. And I was talking with his doctors and really hoping that they would send him to rehab for 5 days after the surgery because we lived in a house with 13 stairs. He had fallen down the stairs a week before his scheduled surgery, and all they did was postpone his surgery for 2 weeks. There was no MRI that was called for. There was no wondering like what's going on with George. And these were doctors, his primary care doctor who had to clear him for surgery, his psychiatrist, and his orthopedic surgeon. They had all known him for years. So these weren't like, oh, you're new to me. We don't understand you. And I was advocating for him because we were separated at the time to have 5 days in rehab because I know that they can do that if they feel that it's unsafe for the patient to be discharged to home. And they just didn't do that. And so we wound up in a very serious, dangerous healthcare crisis. Luckily, we had means, so I was able to get 24-hour care there, 24/7 care there for him. And that began us on a journey where I have worked in healthcare marketing for many years, and I knew a lot about the system, how it worked, what it was one should do in terms of advocating for oneself, all of it. And I did all these things, and we still wound up in a place where I was frightened. And I was like almost, I mean, literally to my knees. And I thought, if this is happening to me, someone who's very, very well educated, what are just everyday people doing? How is anybody getting through all this? And that's what sort of led me to begin to tell people stories. And then it led me to get even more clear about essentially developing and architecting a whole system for helping people, curriculum, become their own health advocates.
What about that situation as I feel like most people live in there's the above ground and like it's an Alice in
Sure.
Wonderland thing. When you get disabled or you have a health crisis, it's falling down a rabbit hole and all of a sudden everything's very strange, backwards, weird. There's usually someone who wants to like cut your head off. It's a whole thing. What in this situation as you went down that whole rabbit hole of you weren't used to dealing with the medical community in that way really surprised you?
Well, so a couple of things. Like, for example, I was on the phone with the surgical coordinator. I mean, I remember this like it was yesterday. It was actually 8 years ago. And I was on the phone. Well, actually, we were messaging, of course, because, no one talks on the phone. So we're sending these long text messages back and forth to each other. And I said, are you aware of the medications and the dosages of the medications that George is taking? And she said, yes, of course, it's all in his electronic medical record. Well, I assumed that that was a doctor to doctor transfer of the electronic medical record. And of course, that was completely wrong. It was George who had given his list of medications to the surgeons, and he'd given the wrong doses. So they were never aware. And I was, of course, saying all these things, and they wrote me off as the hysterical wife. And when, and things got bad after he was, discharged to home after the surgery. We were having serious, serious issues. I had a angel of a home care nurse who was advocating and helping us and taking George to appointments and so on and so forth. And he was the one who got me to understand what was going on. And I would physical therapy would come to the home and nurses would come to the home to check on him. And I would ask all of them, please, will you please give the true state of George's condition to your superiors because we need more help here. And no one would do that because they didn't want to rock the boat. So I went all the way up the chain of command and spoke to the director of home care, a nurse, a nurse practitioner at the hospital. And I told her the whole story, my concerns about his medications, that he might be taking them in the wrong way, that the doses were too high in the first place, that, he had fallen down a flight of stairs, but no one had done anything about it, and she gave me a set of steps to follow, one of which included confronting the primary care doctor and asking why he hadn't ordered it and why he hadn't noted any of these changes in George's affect, and that began the journey of going through a series of doctors to get him finally the help that he needed.
It's so if you're listening to this online, let me just explain. The two of us are both palm colored. So we are talking from a place of significant privilege in the
Yeah,
healthcare system. And this is still what's happening. And it was happening. And also the other privilege was this was happening to a man. And I not to say that men always get better care. I'm just saying in my personal experience, my father and I had very significant health issues. My father would get care without question, where I was almost put into a mental hospital for my symptoms. Like it's a very different thing. So if we're talking about it being this bad for a palm-colored man, like and I'm sorry, I didn't ask if he was, but we are both palm-colored women who are dealing with the healthcare system, and this is how we're being treated. That means that it's significantly harder and worse for everyone
that's right.
else. And
No, that's
that's scary
absolutely
because
right.
there's also yeah, and there's no system set up within the healthcare system to do what you're doing. Even the ones that say they are, they're not really there. It's like going to HR almost. Like if you go to HR for your job issue, they're not there to protect you. They're there to protect the company. Same with a lot of the advocacy groups within the medical system itself is there to protect
No,
them.
you're absolutely right about all of those things.
Sorry, I'm just coming off of a major issue with the healthcare system, and I'm a little twisty and cringy and twidgy and all the other idgies. So if I get a little intense, that's just because I'm still a little traumatized from what just happened. So can you explain a little bit more about this thing that you built, the United States of Healthcare? Because it was an impressive website. I just spent hours
No,
and hours going down a rabbit hole with your blogs. You have so much free information. So if you're hearing this and you like raised an eyebrow and you're like, okay, so there's a healthy person making money off of this again. This is
yeah.
not what it is. And go to the website immediately because you're going to see so many free resources.
Yeah.
So please tell me about this model that you're using, what you're doing, and how you want people to use this.
So when I created United States of Healthcare, it was important to me that, first of all, there'd be things told in a story fashion, right? Like, here's what you can do. And also a lot of pro tips. So every blog post that we have is full of pro tips. So here's a tip on what you can do. So we try to give you, if you go through a blog post on how to be your own health advocate, on how to set up a personal health record, on what does it mean to, how do you prepare for surgery, whatever your topic is that you're looking for, you're going to find different pro tips in all of those blog posts that will give you very concrete ways of doing things. And what I'm focused on these days more than anything is the doctor visits. So we do have, they're just being finalized now because I have redone the two guides that I have for helping people prepare for their doctor visits. Because really, that is where, or nurse practitioner visit, because this is where the rubber meets the road. So we have tools, and I'll tell you about them in a minute, that will help take you through what to do to prepare for doctor visits and what to do between visits. Because that's the other thing, what kind of communication between visits. So, what we created was, it doesn't matter what kind of condition you have, it doesn't matter what kind of situation you're in. We would use the term condition agnostic content on how to be your own health advocate, because there's a whole series of things that we need to do to advocate for ourselves. And so that's what we try to do, is create a comprehensive resource, because also when you think about people with, and it's usually women, mostly women who have rare diseases, autoimmune disease. It takes 5 to 8 years, right, on average, to get a diagnosis. So, what do you do in that time? It's not like, oh, I was diagnosed with, and you get a label. Okay, But then you can go to a national organization and they'll have resources for you and you'll be able to look for groups or other people. When you're searching for a diagnosis, that is the time when you need support the most. And where do you go? People like yourself, what you've put together, that's one place, but so is United States healthcare because we are not focused on any one condition. We're focused on health self advocacy as an essential life skill that we can learn. And so, what we try to do is give all those resources to learn them, including insurance resources. So, we don't pretend to be experts on that, but I do have some experts, and we have a fairly good primer there, several videos and blog posts on how to select insurance, what to do when you get a denial. And we'll be doing a 30-minute Zoom meetup on the 22nd of October, taking people through one of our tools, which is how do you compare different plans and what are the key features to compare in order to make your decision? Because no one's taught us how to do that either.
I'm gonna be there. That this expression is the I need to sign up immediately. So I'm so sorry. We are an international podcast as well. So just letting all of you know who are listening to this, going, what are they talking about? We are both in America, and I just want to give a quick explanation for all of our people who are listening in other countries. Fight with everything you have to keep this from happening to your country. This is what we deal with. All of our stuff is through insurance. You can get a PPO or an HMO. Those are mostly the two ones, but at least with my insurance, I have to pay $8,000 before they will cover anything. And then after that's only 80%. And my last hospital bill, if anyone's keeping track, was $8,000 for a 3-hour visit. And all I got was a banana bag. So just letting you know, like when you have a heart attack, we're not talking like your numbers. Like when you're thinking about, I went to a hospital in Canada, I broke my leg, the MRI was, let's say even $1,000. My MRI was 16,000. So we're just letting you know, like when we're talking about something, you're like, I know it bites to have to pay that much. I need you guys to understand what that much is. Helicopter to get like lift or lifted to another place, 20 to 40,000. Ambulance, we take Ubers because they're $3,000 to $8,000. So just letting you guys know what you think the number is over there, not here. Like my banana bag was $1,600 with $900 per needle stick because she kept having to stick me. So just to kind of give you guys a general idea, as you're like, but our NHS sucks. I'm sorry, maybe, but not like this. Just letting y'all know. So, okay, I'm so sorry. I have to always put that little
No, no, it's
disclaimer in because
yeah.
I get to hear from people all over the world and they tell me, like, yeah, it bites over there, but just like, it's really bad over here too until we start talking. And then they're like, okay, yeah, I will absolutely be fighting for this. So, what are you discuss some of the free resources on your blog? You're having this incredible thing to discuss the differences and how to choose your healthcare
Yes.
because my goodness, it reads like War and Peace. If it was written by my like 8th grade math teacher, it is hard to get through.
Yes.
And you have a lot of free resources on what to do before and after doctors. What are some of your favorite things that you're like, I am so glad I put this in here. This is why I'm doing this. This is the resource I wish I could like tattoo across the sky.
Well, I'm going to answer two because I think
No worries.
the most important one really is how to prepare for the doctor visit, what to do during the doctor visit, and then what to do after the doctor visit. And I want to say to people, these work because I have friends all over the globe and they read my content and it applies. I have friends from
Hmm.
China, from all over Europe, from the UK. They use these resources. It all applies because it's the same process. And of course, there's what we have to do to prepare. There's what to do during in terms of what kind of questions to ask, what questions can you use in almost any situation. And I don't mean, genericizing healthcare. I don't mean that at all. But, the one thing that happens to all of us is the freeze up. Either we freeze up or they're going too fast, or then suddenly our head is swimming and we lose track of where we are in the visit. Now, these visits, the system, and I know this to be true even outside of the US, healthcare systems are built for speed, not for connection. So, unless we come prepared and know that if we freeze or our brain starts going forward and we're not paying attention anymore because we're not connecting anymore, we need to ask the physician to slow down. Hang on a second, doc. Can you just slow down there for a minute? I need to make sure I got everything that you just said. Could you repeat that? Or I'm going to repeat that back to you. or all of these things that we can do to take control back of the situation for ourselves. And I don't mean to be in a fight to wrestle for control with the doctor. No, I mean to be driving the pace of the conversation because this is our health that they're talking about. And it's important that we understand what they're saying. And it's also important that we come into the visit as a partner because the doctor or the nurse practitioner, whoever it is that you're seeing, is our expert ally. They are not in charge. We're actually the one who's in charge. And they'll be the first ones to say, most of them, that they want patients who are engaged because they know an engaged patient is going to follow through because then there's what happens after the visit. And what I love about the tool is that we talk about taking 5 minutes after the visit and debriefing with yourself while it's still fresh in your mind and not just running off to the next thing. Even sit in the waiting room, sit down, get a water, get a tea, and remind yourself of what happened in that visit, and then tie up any loose ends because maybe there's still, you're like, oh, I didn't ask that question, or you know what, that's not clear. That's right. He told me to make a follow-up appointment. He said I could get the referral from the front desk. These things can fly out of our heads in the times it takes us to get dressed and pay the bill. So that those are some things that I think are like critically important. And if we do these things, it can change the game for us in terms of what our outcomes are in the short and the long term.
That is one piece of advice I've never heard before, and I think it's a phenomenal one. If you have an Apple device, you have something called reminders and notes. I highly recommend using both of those because they're already a part of your ecosystem. And with notes, you can just have like your different binders and folders right there where you can journal it. You can even make it look cute. Like absolutely
Yeah.
add some cute stickers into it. Have some fun. The reminders will actually remind you where and when you should do something. So it will automatically I have Ehlers-Danlos, I'm on so many meds, I can barely remember anything, so I could have the doctor tell me, "You need Epsom salts," and then I could have, put in reminders and have it whenever I go to CVS, it would just pop up and go, "Buy your Epsom salts." So those are just some ways to automate what you're saying and some free resources. I think if you have an Android, you might still have Google Keep, but just letting you all know you might be real cautious about using Google for your healthcare. Just a quick little warning for everyone on how they're training their AIs and what they're releasing. There's a lot of different resources. I think you can use like GoodNotes 5, and I think that's only like $19 a year or something. I know it's pricey, but it's still just another way you can do that. What is like the one thing you wish everyone would do before they walk into a doctor's appointment?
Take the time to, I journal a lot, but take the time to have a visit with yourself
Oh,
2 days
good.
before the visit if you can, about what it is that's most important to you to cover during the visit, and to really be clear about that, and almost, I'm not gonna say memorize or anything like that, but just to know, write them down. These are the 2 things that I wanna cover in this visit, and these are the reasons why. And know and practice that a little bit. Just saying it in your head, saying it out loud, you're washing your face and not making a big deal about this, because there are data that show the doctor will interrupt us within 18 seconds of opening our mouths when we walk into that office. So it is, I say this because it's important to take a deep breath before we go in, know what it is we want to say. And I like to send it in advance, either if you do have either email or a portal situation, or bring it on a handwritten piece of paper. It doesn't really matter, and hand it to the doctor. As you're saying it, they're reading it and they can read faster than you can say it. These are smart people. They're putting 2 and 2 together. They now know what's most important to you, what you want to cover in the visit. And you're already 20 steps ahead of the game because it's not about getting more time. It's about utilization of our time to our best advantage.
So, how can we do that? Because I feel like this is almost like a job interview situation, especially for people with ovaries who present as female. We have all the data that when we go in for a job interview and we ask for a higher amount of money than they record, that when men do that, they're seen as leaders and they're more likely to get the jobs. If a woman does that, she's seen as unlikable by even the other women in the room. So I'm just saying, like, there's definitely an issue when you go into a doctor's office on like how to ask for what you need, how to be clear about what you need and advocate for yourself in a way that's not going to make them put in your chart difficult, intransigent, in the words, sorry, words are not working for me today. But I think I get my general gist of like where we get things like difficult to work with, which can have real world consequences, especially for chronic pain patients. How do we advocate without becoming, and I hate to say it because like we shouldn't care as much about if we're likable or not as we care about our own health, but if they don't like us for whatever reason, sometimes completely racist, arbitrary, or all the different, and I won't call them fears. I'm just going to call you an asshole if you decide you don't like someone based on how, where, or why they were born. But that's a real world issue, I, especially for people who do not look like you or I. How do we do that? How do we get to a point where we can still advocate for ourselves even through that fear? And how can we advocate in a way that will most likely get us the result we want? So
So,
it
I
was a
mean,
long way around to a small question.
no, it's a lot, and it's a lot to unpack. So we know that there's okay, we know that there's bias in the world. We know that there's bias in healthcare, especially against women in general, and and then women of color, and you just sort of go down the list of everyone who's had to.
Even my the people who I'm friends with who are trans, the issues they experience going in for even like the necessary important care, like it's like even if they just go in for a broken foot and they're like, well, it's probably because you're trans. It's like when you're overweight, it's like you go, like I go in and they look at me and they're like, well, have you thought about losing weight? Like, no, I'm a person who grew up in the 90s. Obviously I've never ever considered losing weight before. What? Never heard. Thank you. I've never heard that before. It's like anything is like brought back to those issues instead of like actually looking at the modality of what's going on. And when you said they're all smart people, I'm like, maybe.
I just meant in terms of processing data
I
and
know. I'm so sorry. Bad joke.
but so the thing is there is bias and we have to be aware of it. There's gaslighting, and we do have some blog posts on gaslighting. I mean, that happens to especially those who are still in the phases of seeking diagnosis. We're told it's anxiety, it's in your head. These are very, very difficult issues. I'll say a couple of things. Number one, the thing that I say to everyone is manage your state before you go into the visit, right? So, take a moment to sit, ground yourself, and understand how that. I just did a Facebook Live on this. How does that professional you're about to see make you feel? And I have the wheel. I should go get it, but I don't want to get up and disrupt the shot. The wheel of emotion,
Mm,
and look and see where you are on the wheel of emotion as to how you feel about this doctor, and then recognize your own, whatever it might be, anger, disappointment, whatever the feeling is, just name it and say, okay, look, you're feeling this now, but I want you to know that, you know, we've got this today, and we're going to be our best self and go in there and take care of business, because we're about to go into whatever you need to tell yourself. We're about to go into a business meeting for our health, right? And try to
that's good.
try to work with our emotional state, just like we would do at work. Whether our work is as a service person or our work is as an office person, we still need a certain code of behavior. And it's the same, it's the thing here. And I think also we always have to speak with respect, even when we are upset. Now, I remember once being in the dental chair and I was being told that I was losing a tooth. I was like 35 years old and I was losing a tooth, and I was extremely upset about it. And they wanted to, because of the situation, they wanted to take it out right then. And I got flustered and I didn't know what to do. And they just wanted to push me out. I was like, okay. And I just remember having the thought, they don't want to deal with my emotional state. And so took a breath and I said, look, I don't want to just leave. Can you just help me to get to where I need to? Because I'm upset about losing a tooth. And then they were able to work with me. So we really do have to be our own almost parent to the upset person in our internal world when we're going through these things. And this is why I say, know how you feel about your doctor in general before you go into any appointment, because it's then you can manage your state before you go into the room, because maybe they will trigger you. And then what do you do?
I love what you're saying because what you if I'm I'll just repeat what I'm thinking you're saying, and let me know if I'm wrong. But what I'm hearing you say is that you may not have the right outcome and you might have to deal with people who are cruel or bad, but the only thing you can control is yourself. That's the only
Exactly.
thing you can do. So if that's the only thing you can do, you can really like focus in on making sure that at least you are doing the thing you need to do, even if the other people aren't, which, living in the United States, I feel like this is a very, very pertinent discussion right now.
Yeah. I mean, this is what it takes. This is what it takes, in my opinion. The other tool that we have for anybody who's in the process of looking for a new healthcare provider, or maybe you just have a new healthcare provider, doctor, nurse practitioner, it doesn't matter. It's an interview guide. And I strongly
Mm.
suggest to people, like, I have to look for someone might be having to look for a new specialist. Okay, I've got a referral. There's a couple of people I need to see, or maybe there's just one person that's available to you. I still say, if you have the means, pay for a consultation appointment, go and sit with them across the desk, not in an exam room, in your paper gown. Sit with them,
That's a position of power.
right, with your feet dangling. No, sit in the office with them and interview them as you would any person that you were bringing onto your team, whether it's somebody you're bringing into your home to do work on in your home. The new person is going to do your hair, whatever it is, right? We try to get to know them a little bit, understand, have they done this before? Even if they're a specialist, have you worked with people like me before? I mean, anyway, there's a whole list of questions there. And I think it's really important because it helps with agency. It just makes us feel like, hey, you know what? I am the one in charge here and I do have a choice. I do have a choice. And then you get to know each other. You also get to see the affect of that person. Not all doctors have the warmth of, say, nurses. Nurses are trained differently than doctors. And I don't know if people know this. Doctors are trained in disease states and in how you go from step to treat a disease. Nurses are trained holistically in patient care and human behavior. In how do you work with the individual in front of you? So, clinicians, even though, yes, they're not strict scientists, but they are not trained in how to work with human beings. So,
I very much feel that. Now, we've been talking about things in a way that are like this almost feels like an almost ideal situation that we're talking about of like people who may not be doing the right thing but might want to. What happens if we are in a situation that has gone upside down and sideways? And I think we both can acknowledge that with this great, beautiful bill that passed, we're going to lose a lot of rural hospitals. We're going to lose a lot of specialists. And there are multiple states right now that don't even have a properly staffed OB hospital. Like we have people driving 3 hours to give birth. So you're not going to necessarily be able to even choose your own OB. You might not be able to find a pain clinic in your area. You might just have to deal with the cruel and horrible person in front of you. So how can we prepare ourselves if we have to have a relationship with someone who already is judging us, does not like us, and we're in like the worst possible situation, but we can't choose someone else? How can we prepare for that?
yeah, I mean, so I still say, okay, so you're saying we already know somebody and you're in a horrible situation.
Totally not a personal story at all. No.
So the other piece of advocacy is to know when it's time to bring someone with you. And I wanted to mention this,
Mm,
talking about bias and bias against women in healthcare. And I know it's irritating to have to say, and I say this to anyone, no matter what your sexual orientation is. If you're a woman, bring a man with you that you trust. If you have a man like that in your life, to your appointments, because the most important thing is that you get what you need for your health. Yes,
yeah.
is it irritating that you would have to take a step like this because you're being completely ignored, called anxious, said you're a problem because you're asking questions for yourself? He can say the exact same thing that you say in the exact same tone of voice, and all of a sudden, the answers are given. Well, if that means that you're getting what you need, then you won.
Staying alive is more important
Healthy.
than Yeah, because if we stay alive, then we can fight the system. We cannot fight the system. The system does not have Ouija boards set up. I'm sorry. Like, we've gotta be here on this plane to fight this.
Yes.
Yeah, I have big, tall, scary son privilege that I can always call in, which is a very almost made those 3 days of labor worth all that. He is
Sure.
lovely. He is tall and scary, and he is very helpful to his sister and I whenever we need something, and I do hate that. It makes me angry. I have far more college education than my son. I know a lot more, and yep, still every time. What have you seen in oh, actually, no, I wanna go to this question first. What can we do about the power imbalance? And this is something that I've been very focused on lately, especially as I've been on TikTok, and I'm watching doctors and nurses use us as content and have because I'm a chronic pain patient, I have an insane power imbalance with my doctors. All they have to do is write on there any little detail that makes me look bad, and I can never get medication again. So it's this very wild power imbalance. And even going into my GP is very scary because again, to get the care I need, especially with invisible illness, I have to get them to trust and believe me. What do we do about this power imbalance? How can is there anything we can do to fix this? I mean, you've already given so many amazing tips for how we can emotionally prepare for that power imbalance, but is there anything that can actually be done about it?
I mean, I don't know. I think that what this comes down to is, these are systemic issues, that require systemic change. And I think that it's incredibly scary. You're right to know that you're in a situation where you're talking to a healthcare provider and one false move and they can blacklist you. I mean, let's say it for what it is. I think this is a question for doctors and nurses to say
Yeah, probably.
what is it that patients can do. I mean, I think I think this is an important question that you bring up, and I don't know if I have a really good answer for it.
Totally fair. I try to explain this to other people of like going to
Yeah,
any doctor is almost like going on a date. That you
yeah,
don't wanna look like you're too put together because then you're healthy, but you
yeah,
don't wanna look too not put together because then they're gonna think that they'll make all sorts of inferences about you. You don't wanna look like you're too expensive, but you also don't wanna look too poor. Like, it's the same walk that I think most of us who have ovaries or look female have dealt with our entire lives, which is that impossible middle ground of, like, you don't wanna be too bitchy, but you wanna get what you want, but you don't wanna be too submissive because then you're a doormat. But, like, all of this is crazy, and then the onus is on us who are sick and in pain and terrified to be the well-behaved ones, and that's really hard.
yeah. I mean, the other option, and I think if people have the means for it, are, there are professional patient advocates, and there's a national organization in the US of patient advocates. And these are mostly, I won't say all, but many, many, many of them are nurses. So they
Mm.
have been through the system. And I think they become important to bring onto a team when you wind up in a situation where you do have this legitimate fear that you're in a power imbalance and that you have to bring in every possible resource to ensure that you maintain that balance in a way that so that does not tip in the wrong direction. And I think then you have a greater chance of not having to put yourself in a situation where, like you said, where you're sick and you're scared, and then you also have to advocate for yourself. I mean, it's
Yeah.
just too much. There just comes a
Nothing like
point.
having a dislocated shoulder and trying hard to walk that line of, like, I'm in pain, but I don't necessarily scream from a dislocation, and then you think I'm hysterical or you're not gonna it's a lot.
Yeah, it's a lot. And the one other thing that I will say, just in terms of a data point, is that there are data, and I think it was from an ICU in the United States that showed that women in the ICU got less pain medication than the men in the ICU because they weren't believed. I mean, it was, and it shocked the members of that team in that ICU. So this bias
Black
is real.
women can tell you for decades they've been sent home from surgery with Tylenol.
Serena Williams. I mean, look at
Yep.
her story. I mean,
Oh
look
my
at it.
god.
I mean,
Yeah.
when you think about it, it's like, okay, it doesn't matter. They're biased against us. Yeah.
There were textbooks up to 20 years ago that the medical textbook said Black people feel less pain. And it's like, I the rage. Anyway, not anyway. That's something we absolutely discuss here on this podcast. I am still looking for a new podcast host to take over the discussion on race and chronic
Mm,
illness, disability, and hospitalization. If you are someone who's interested in that, please DM me because we really need someone to be talking about this, and I'm not the person for that discussion.
we need
I mean, I
someone.
absolutely will keep screaming about it. I'm just the wrong messenger. So I think we're probably pretty close to the same age. What have you seen change in medicine since you started becoming aware of what was going on in medicine?
I think one of the things that I've seen, and maybe it's just because I'm paying more attention, is that, there are doctors out there, even of a certain age, who really want to help patients and want to teach patients how to advocate for themselves. And I think that, that's one thing. The other thing, of course, that I've seen, and especially in the US, is that our care has become, we don't use these words, but we have less access to care than we once did, and medicine is rationed in in the US through what happens with insurance companies and denials and what they'll pay for and what they won't pay for. And so I think what's become more important than ever before is to become comfortable with the paperwork, unfortunately, that goes along with it, and that a denial is nothing more than someone saying, I need more information. The word denial brings up all sorts of emotions inside of us, but it means nothing. It just means they need more information. And if we, and so these are the things that, have been added onto our plates, I think that, just weren't the case in you know, the good old days when we had really good insurance that covered everything that we needed and we could rely on it like a nice, comfortable chair. Those days are gone.
Unless you're lucky enough to be grandfathered in like my parents are, where they have 100%
Yeah.
coverage of everything from a government job, like,
Yeah.
that is just not our world here in the US
That's right,
anymore.
or the United States Congress, they have great insurance. They have wonderful.
Yeah, funny about that, isn't it? How there so many thoughts. Sorry, I think I just, like, cracked a molar on the rage. Yeah, fun. So on your website, you have things like 5-day challenges. You had something that was how to keep the undivided attention from your doctor, a 5-day challenge. I'm not asking you to give me your challenge, but what are some of the things that you do for a challenge? Like, is this thing that is a community thing where people can get to know each other?
I mean, that actually that should probably come down because we're not doing the challenge right now, but what one thing I am gonna be offering soon so that 5-day challenge was all about, the doctor visit again, like, you probably I probably sound like a broken record, but it really becomes
Nope,
the.
we need to keep doing that. Oh, I am so sorry. Real quick, what we had talked about before, about just right before this question, I'm not a big fan of AI. I viscerally hate it. I cannot stand what it's doing to
Yeah.
the environment and to people of color and to socioeconomic issues there. It's really terrible. However, since it exists and since it's here and you're sick, and harm reduction, not removing everything, just what you can do, you do. You can take their notes, you can throw it through Chat GPT, and you can say, in real world bullet point language, tell me what I need to know from this.
Yes.
And that is a quick way to get through all that paperwork. Just saying.
Yes. Listen, I'm working on a tool right now to help people use AI if they're using AI to ask health questions. So that's coming. And I have a lot of great experts helping with that because there are things to look out for if you are using it. And then there's also kind of prompts that one can use, just one sort of master prompt. Because if you're using AI, it's important that you instruct it. It is not Google. You cannot just type your question in there. You have to instruct it in
People
a.
don't understand it. It's a
No,
predictive model. It's not researching for you. It's
that's
just
right.
predicting what it thinks you want to hear. This is not the Oracle
It's
of Delphi. This is not your surgeon. But if you can instruct it properly, it can go through your information. So I'm really
yes.
excited you're doing that. And if you're terrified of the environment, yes, this is a drain on it, but it's not generative AI. Generative AI is the real one that like if you make a video or an image, please don't do that. You're stealing. I'm an artist. Stop it. But if you're doing that, that's what is pulling all the energy. The 1 minute video of generative AI is as much energy as one whole household for a day for a 1 minute generative AI video. Please knock it off. You don't need that. No one needs that. So if you like, the things we need are to use AI to get through a whole lot of BS, or like a whole like if your insurance company sends you a denial and it's like War and Peace, it's like you could stop a door with it. Run that through. You can do that, and you can just ask it, please just bullet point this for me, and then tell me. You're much better at what the actual prompt should be, but like you can ask it to tell you what should you say to get this through. There's a new AI company that's coming out that will help us fight the insurance companies too.
Oh, this is great.
I'm really excited for it. I'm like, yes, please,
This is
let's do
great.
that.
We need
Right,
this.
use AI for the right thing. So I'm so sorry. I just need to throw that out there because I just think it's one of those things that everyone needs to know, especially since not everyone has someone who can go with them or can understand. And oh, by the way, I'm so sorry, everyone. If look at the laws in your state. I'm in a state where you can record without
Yeah.
consent, but
Yep.
you definitely want to ask. And the way to ask is not for my protection or for your protection. The way you ask is, I have a really hard time remembering things, and I need to get this in a transcript form. Can I please record this for my future records? And that way, you'll much likely get a yes.
There you go.
So I'm so sorry. I totally derailed that, but we're coming right back to your
I was
challenges.
good.
Now, I just had never heard of doing challenges for something like this, and I
It's
was just
really
curious what
fun.
that looks like. Like, I'm so intrigued.
It's basically what it is. It's just to, I mean, look, okay, we talk about gamification. Like we're human beings, we like to play games. It makes it
Yep.
fun. So if you can make something like preparing for a doctor visit fun, then we're going to, then we're going to do it. So it's just to break things down also into bite-sized pieces. And in these things, there I am, there's my voice, there's a short video, and there's somebody who's like, who's taking you through. I do also have a group on Facebook if anybody wants to get involved. It's called Let's Talk Healthcare. And there I leave videos and tips, and there's other people. If people are looking for community, in terms of health self advocacy, then I'm your girl.
That is amazing. And we will have a link to that in our show notes. So if you are listening, you just go over to our website, invisiblenotbroken.com. And then if you just click on this episode, I will have links to everything. You can just hit the button, or you can go directly to your website, which is United States for Healthcare
United States of
of
Healthcare.
Healthcare. This is why you
Mhm.
don't listen to me directly. You actually look at the writing because when I'm talking, my brain is doing its best, but that's never enough. And that sounds really cool. And I do love gamification. I think it is the way to get everything done. I wish PT, physical therapists, would learn this. Like, if you want me to exercise, let's make this a little more entertaining. Anyway, so sorry, it's a sideline there. Okay, so do you have any personal stories since you started this where you're like, aside from your own with your ex partner, do you have any stories of people that came back to you and told you something you're like, oh, yeah, that's why I did this?
Yeah, I mean, it just happened the other day. I got a call, what was a message from my former brother-in-law. He's like his best friend. His sister was in the hospital. She is has cancer. She's in treatment, but now she's in the hospital. And okay, she needed to go to a subacute rehab facility. And
Mm.
the hospital said, "I'm sorry, but her insurance doesn't take, none of the places that we want to send her to, the insurance doesn't take." Will not take her insurance. And so they told them their option was she could go to a nursing home facility, at a skilled nursing facility, and then they could pay out of pocket. And I said, okay, that's not right. So I swung into action. I sent him some copy that he could put into an email. I said, you have to write the caseworker and it's ask them to advocate for your sister. And she's now been, they found a facility that would take the insurance because, even if this is important for your audience to know if they don't know this, even if you need to go to a certain doctor, hospital procedure, and your insurance says we don't cover that, they can be asked to make a one-time exception if the doctor says it's medically necessary. Now, it's not always going to happen, but this is a thing.
Never knew that.
It's a thing. So again, everybody has to know their own situation. And I'm not a professional advocate for taking people through insurance, but these are general things that are out there. And that's probably, I'm not exactly sure what happened, but I think that's probably how they got her into one of those facilities was they asked for that because we put that into the letter. Please ask for a one-time exception. If they refuse it, then we want to have, as you had mentioned earlier, a doctor to doctor case conversation, meaning her doctor and the medical doctor from the insurance company in order to come to a conclusion. So that just it made me feel so good. It got handled like that.
That's amazing. I'm really kinda scared of what's gonna happen as we are hearing that more of these, insurance companies are gonna use AI to decide on, I don't know if you've heard the news, but there are 5 states that are allowing AI and buying this AI, modality. I don't know what you call it, but they are allowing AI to decide who gets what treatment, and they are paying out a bonus every time that AI denies someone. So I'm getting scared as like we're kind of almost losing that doctor to doctor ability, and it's going to be doctor to machine learning, and that's concerning me
Well, I think
drastically.
when it comes to a denial, I don't think that yet we're in a place where you would not be having that be a medical director at the insurance company that would be having that conversation with your doctor, whether or not the denial came from utilization of a data analytics tool like AI or not. I mean, I know that this sounds horrible the way they said that they're being bonused for denials, but that's essentially what's happening in our system
It's
now.
always happened, by the way,
I
just letting
mean,
everyone know this is not new.
it's
It's
not
just
new.
it's new to use a computer which has not gone through medical training.
Yeah. Yeah. Yeah, although, there have been for at least the last 10 years, they have used, machine learning to help with, triage. There
Yeah,
have been avatars that have been created of doctors in triage situations, like for, sore throat level
yeah.
medical issues and things like that. So there are positive aspects of technology. I'm not against it, but, it's like anything. It has to be used for good, not evil.
Every tool is a weapon if you hold it right. Anyone who's an expert in this, please contact me because I really want to do a show about how AI is going to be working in medicine, the good, the bad, and the ugly, because there's some really incredible things. Like AI is finding breast cancer a decade before it shows up on screen. There's some really cool stuff. I just want to talk to someone who actually understands it because my understanding is very basic.
Well, I
If you had a magic wand and you could fix this whole system, what is the first thing you would do?
think the first thing that I would do is have everyone walk into any care situation with the belief that they are the expert of themselves
Mm,
and everything that they say and feel matters. I think that is the most.
that is wonderful. Is there anything you would do to fix the system? Like
I
magic. This is magic. This is
yeah,
a
I
magic
yeah,
wand where you
yeah, no, no. I think the magic wand for me is that the healthcare provider is able to take the time they want and need with
mm,
each patient on an individual level so that people are getting personalized care. Not because right now we're not getting personalized care. We're getting generalized care and it's been generalized to men mostly. So, I say personalized care.
yeah, that's, if you are not aware and you're interested in medicine at all, almost every procedure, almost every drug, almost every, protocol has only been tested on men, never on women's bodies. So, just letting y'all know if you're not clear on that. If you're on TikTok at all, there's some guy who just learned about women's health and is crashing out on the app, like losing his mind. And it's weirdly healing to watch, but I'm realizing how little 50% of the population has had any like zero curiosity as to what the other 50% of the population is going through. Watching like that group like wake up and go, "I'm sorry, chainsaws were invented for what?" has been like oddly healing. Like, we need them to start paying attention and learning about what everyone else is going through. Sideline there. So we are almost at an hour. I would love for you just to tell everyone what you would like them to do right now. Do you want them to go to your website? Do you want them to like download those free resources? What would you
Yes.
like everyone to do now?
Please go to the website, unitedstatesofhealthcare.com, and then you can go to our free resources page. Please subscribe. I mean, you don't have to subscribe. We don't spam you, but please subscribe because you'll get our updates on all of the things that we're bringing to you, all of our free resources and expert information. And also you can try checklist.unitedstatesofhealthcare.com if you want to get that resource for preparing for your doctor visits. So I suggest
I
you can
love that. So send that website over if you know people who are caregivers. Please send this resource over to them. Caregivers are already so overwhelmed and exhausted. This could be a tremendous resource for them as they're going into these appointments with you. Oh, I cannot thank you enough for spending this time with me. I really appreciate you. I hope you have a wonderful day. And everyone, be kind, be gentle, and whatever it looks like to you, be fierce. And we're now at 2 episodes a month. I'm not twitchy at all. It's totally fine. But please feel free to share these. We do not advertise here. We used to have people here. It's just me now. I do not advertise. I do not take advertising. So any way that you heard about this was word of mouth. So the kindest thing you can do is to share this. Share this episode, subscribe. Weirdly, strange place to do that is Apple Podcasts is still our most popular. So if you want to drop a review with kind, you can absolutely read me, tell me what's wrong, but just try to do it kindly. Or at least do it entertainingly. At least make me laugh. One or the other. Totally fine. All right. Have a great day, everyone.